I'm Kelly Callahan, and I have been practicing homeopathy since 2011, teaching since about 2016, and this month is my 5th anniversary with AHE, which is really cool. I'm on the teaching faculty, and I'm one of the clinical supervisors. And yeah, I'm super excited that you're all here, and I'm really excited to be able to do something to support HE and support the Home Foundation, which I have kind of watched gestate and birth over those 5 years, because I came in the year before all of this really got going. And it's just been amazing what's happened in the 5 years since I've been here. I often tell students that I am envious of their education. I loved my training, I really did, but it was kind of cut from a different cloth, kind of a different era in homeopathy education. And AHE's professional program is really geared to prepare students to be confident and successful right out of supervision. I've seen it now with 4 classes. It's one of the coolest things. So if I was going to do it over again, I would 100% be an AHE student. So if there's any part of any of you out there who aren't already an AHE and you're thinking about it, I strongly encourage you to follow that thought. But what we're here for tonight is to do a benefit for the Home Foundation. And this is really one of the coolest things I think that's happening in our field. It's a nonprofit foundation, and they have a 4-fold mission to get clinical homeopathy available to everyone. And that is where Homeopathy Help Now comes in, this helpline. And I was very lucky, fortunate to be part of the kind of founding group of practitioners that stepped up to help when the COVID pandemic hit, and that's kind of the origins of HHN. But it grew because there was a need, and because it works, which is so incredible. We know homeopathy works, but it's never been done before to have this kind of an acute helpline. So there's that. High quality homeopathy research, really needed, really important. Also, Home is working to fund homeopathy study and research at every level, and to curate a comprehensive historical and research library. And I love that bit because that's actually how I met Denise and Al. They inherited a library, and I was following them on Instagram. And I was doing a podcast at the time, and I was so excited about these books that they were inheriting that I reached out to them to do an interview, and they were like, yeah. And so that's how we met, and the rest is history. So I have a little soft spot for the library. But Homeopathy Help Now, this piece is really, I think, kind of a piece I want to highlight, because it's very integrated into what I'm going to be talking about tonight, which is acute prescribing, and how we can be the best home prescribers and acute prescribers that we can be. And sometimes there are things that trip us up, and when we need help, we can call Homeopathy Help Now. So I hope you get a lot out of tonight that will kind of level up your acute practice at wherever level you're at. But we got your back, if you've given a remedy and you're like, I don't know, what do I do next? We handle a lot of those cases, and it's a really cool thing to help people kind of see what we do, starting with what they got going, and kind of help finish what they started. I think it ends up being both a clinical win, but also a little educational win at the same time. All right, what we're going to be talking about tonight is how to establish some best practices and how to avoid some pitfalls when you're doing home prescribing or acute prescribing. And the way I kind of created this was, I hope there's something for people at every level, whether you're like totally brand new, and you're just kind of getting into homeopathy, or whether you're in acute studies, or whether you've been home prescribing for a while, or even if you're a practitioner, who knows, sometimes maybe people say things in a way you haven't heard before, and it's like, oh yeah, kind of hits you a little bit different. So hopefully everybody will leave with a little something. So of course, we all need to kind of start off on the same page, which is just reminding ourselves of the 4 pillars that make homeopathy work. And the first one is, of course, the law of similars. It's like cures like, right? If we don't pick a remedy that follows the law of similars, probably not going to get very far. But we also need to individualize our cases. We need to consider a totality of symptoms and that is individual to the person. So that means not the cold that the brother had last week, or not the way that mom's cold looks right now. We're not going to base it on the remedies that they took. We're going to make sure that for each person that is sick, that we understand exactly how they are experiencing their illness, and understand their totality. So we're going to individualize it so that we can find that individual remedy that they need, because that's what's going to be the most similar to them, right? Is when we understand exactly how that person is feeling ill. The next thing is that we're just going to give a minimum dose. We're going to give just enough so that the system, so the person's vitality and immune system can get back on track and start to move things towards resolution. I often use the metaphor of teaching a kid how to pump on the swings. It's like you give them some pushes, but as soon as they start like getting the idea of moving their legs back and forth and creating some rhythm, you can stop pushing, right? They've got it. They're going to stay in their rhythm and they're going to keep going. And if they get tired, you give them another push. But as long as they're going, you don't keep pushing. We know what happens if you keep pushing, right? It's like the chains start jumping and they start going really high, and it starts getting a little bit dangerous. So we give just enough to get the vital force moving. And then finally, provings. We know our remedies through provings. So healthy people have explained or has experienced and then explained what happened to them when they took a substance. And from those symptoms, we then have a model that we can consider when we're looking at somebody who's sick, who has those same symptoms. And we've got many remedies that have been used over a couple hundred years, from some provings that go back to Hahnemann's own proving guild. So those have served us very well. So I'm going to kind of keep touching back to these 4 principles, because I think all of the pitfalls that we experience happen because we've lost sight of one of these 4 principles, right? But when we get in the weeds of like, oh, what's happening, and maybe this remedy and I gave this potency and it didn't work, and maybe I should give another potency, sometimes we just forget, like, oh yeah, I just have to go back and think about the 4 principles. So while the 4 principles are like the magic of homeopathy, we have to apply them, right? It doesn't just happen on its own. So as the person who's going to be giving the remedy, as the home practitioner or the professional practitioner, we've got to apply those 4 principles. So the first thing we do is we receive the case or take the case. We need to actually talk to the person. We need to hear from them what it is that they're experiencing. And then we have to analyze the case. So that means we've got to spend some time with it. We've got to see, is there a pattern? You know, what's really interesting and different about this? Is there something that is risky, perhaps, that we have to pay attention to? It's not enough just to have looked at it and then just immediately hit the books. We got to spend a little time with it and figure out what's going on. Next, we have to decide the remedy and the posology. So once we've taken the case apart a little bit, figured out what it needs, Now we've got to find what is the remedy that best matches what we saw in the case. And we have to decide how we're going to give that remedy. And we're going to talk more about all these things as we go along. And then finally, we're going to evaluate. So what happens after you give the remedy is a big part of whether or not we're going to have success with the remedy, because what happens tells us if the remedy was a good choice, there was a positive response, or if there was not a positive response, maybe something changed, or there's a new symptom, or maybe there's a little bit of an aggravation, and each of those things will point us in a new direction. But it does not end at give the remedy and wait. We have to do some evaluation. All right. So from there, we got to make some decisions. So when we have a case, the first thing we have to decide is, can we treat it at home? If it's an acute case, the answer is typically yes. If it's a chronic case, the answer is typically nope. This is the idea of kind of staying in scope. The things that would be a yes from the side of an acute case is if it's like an accident or an injury. Somebody falls, you know, maybe gets a mild head injury, scrapes up their knee, burns themselves in the kitchen, you know, something like that. A fever, if there are illnesses that come with a fever, that's a good sign that this is you know, an acute thing. It's a flu, you know, it's maybe a GI thing, something like that. The other thing that is helpful in just kind of determining, is this an acute I can take on at home, is just acknowledging that it is different from the person's normal chronic state. So if that is the case, then this is something you can probably take on at home. But on the other side, if what you're looking at are symptoms the person has had for a long time, they're pretty long established, that's more of a chronic condition, not something we advise people to take on as home prescribers. Likewise, if there are predictable symptoms that tend to kind of come and go, like they have flare-ups, somebody often gets sinus infections, you know, they get them every couple weeks through the winter, or they get migraines that are predictable. They have a tendency to throw out their back, and they know when it's going to happen with a certain type of movement or something like that. So there's an asterisk next to this, because it's not that you can't help that person in the moment, right? Often those things where they kind of have what we call a flare-up, they will often respond to a remedy in the moment that will help ease the discomfort, and can, you know, shorten the duration of that particular flare-up. But the thing to understand is that it's not actually healing the entire condition. It's going to come back, because this is a part of their bigger chronic picture. So if that's the case, then that person should receive follow-up care that is chronic. And we also offer chronic care through HHN. People can choose from 3 different tiers. They can choose from a student in supervision, a graduate student, or a certified practitioner. So puts a little plug out there. But you know, these are things where it's a little bit on the line. And you know, we definitely recommend chronic care for people who have these things that come up very regularly. So they're not really true acutes. And then finally, if somebody is under, you know, medical treatment, if they are taking medication, you know, they go to see a doctor regularly, you know, obviously that is something that's receiving a level of care that isn't appropriate to take on with homeopathy at home. So pretty clear, acute, chronic. If it's acute, thumbs up, then we keep going. Now, this is going to be my little sign throughout for a pitfall. Hopefully some people get my nerdy little reference, Star Wars reference. There are some traps that happen along the way. And I'll just follow up with the chronic. So it's kind of a trap if you start treating a chronic case like an acute, because those cases need a lot more management. There's a lot more decision making that needs to happen. There's way more happening than just the little flare up that you're seeing at this time. So while it seems like it might be a short-lived thing, like it's just a migraine for these couple days. It's just a sinus infection that I get for, a week and then it goes away, but it's going to come back in a month. Those are misleading, because it's like the tip of the iceberg when there's really a lot more underneath. So think about the idea of like acutes are like just a moment in time, but chronics are like a whole season. So stick to your moments in time. But then even in an acute, we have to ask ourselves, do we even have a case? Not all cases need to be treated. And I'm not saying this because I want to discourage people from taking them on, but because I want to save you some frustration. Some of the traps and the frustrating parts of home prescribing is when we try to take on a case that actually doesn't really need a remedy. For example, if you have a case that has very clear symptoms, that is, somebody can say, this thing hurts in this location and it feels like this, and this makes it better or worse, then you have got some clear symptoms. Even better if they can describe it in a really good way, like there's a color, there's a smell, there's a particular pain sensation. They can give you an adjective or an adverb. That usually means we're getting a characteristic symptom. If the person is stuck in suffering, if they're kind of dealing with this for a little bit and it's not moving, or they're super uncomfortable, then yeah, they need a little help. It's like the kid who's stuck on the swing who like lost their ability to pump, right? We need to give them a push. And finally, definitely for, first aid situations, somebody's injured, we can almost always do a little something to kind of tend to that. On the other side, are the things that make it, maybe you want to wait and not treat it. For example, vague symptoms. I don't know. Yeah, I don't know. I don't feel so great. Yeah, my head kind of hurts. I don't know. Throat's kind of sore. Can't really give you any description, or all they have are common symptoms like feeling tired or kind of having low energy, or a little bit of a mild headache or something like that. If we're not getting good descriptors, then we can't match it to a remedy. So remember I said that one of the things that leads us to these pitfalls is kind of losing sight of those initial principles. Well, the first one is the law of similars. And we can't choose a good remedy if we don't have symptoms to match to the remedy. So one of the biggest things I see sometimes is people trying to prescribe for cases that just, there really aren't good symptoms to prescribe on. The other thing is that people might be doing okay. We've got kids who've got 102, 103 fever, and they're on the couch, playing Legos or watching a show and drinking and eating, and they're fine. They don't actually need a remedy. Or somebody's just, kind of feeling under the weather, and really what they need is sleep for a couple of days, some good soup, some tea, and some sleep. And, they're going to be back at it in a couple of days. So that kind of gets at that, like, is somebody stuck? Are they suffering? If they're not, then you know what? They might be good to go. The other thing is if it's a chronic case, as I already mentioned, or it's a true emergency. Now, homeopathy can be amazing in true emergencies, but it's kind of a like, take this remedy on the way to the ER, or take this remedy on the way to urgent care kind of situation. In a true emergency, it's good to get another set of eyes on things and to get the appropriate care. But the thing to remember is that homeopathy doesn't start there. Just because we may need some equipment, or we might need some expertise that is not within our scope for an emergency, doesn't mean that they can't get homeopathy afterwards. Homeopathy is a long game. So having emergency treatment here and there is great when it's needed. And we just help along the way. All right, so again, just with those pillars, If it's vague symptoms, we can't choose a similar and we can't individualize. If they're common or general symptoms, again, we can't individualize. If they're doing okay, they don't need a remedy. And if it's a chronic or a true emergency, it's out of our scope. Now, this isn't something that's just my advice. This actually comes from Hahnemann. So, Samuel Hahnemann, who's the founder of our healing modality, wrote the manual, the Organon, and he said specifically, in the search for the homeopathically specific remedy, the more striking, exceptional, unusual, and odd characteristic, that should be signs, sorry, signs and symptoms of the disease case are to be especially and almost solely kept in view. These, above all, must correspond to very similar ones in the symptom set of the medicine sought if it is to be the most fitting one for cure. The more common and indeterminate symptoms, lack of appetite, headache, lassitude, restless sleep discomfort, are to be seen with almost every disease and medicine, and thus deserve little attention unless they are more closely characterized. I think he said it pretty clearly, right? So we're always in search of those characteristic, strange, rare, and peculiar symptoms that kind of set this person's illness aside or different from all the common symptoms that we would expect to see. Because it's a trap if you get into the common symptoms and you're going to end up looking like this. I have looked like this many times when I'm trying to find a remedy and I just don't have the symptoms. I mean, really, a good prescription starts with a good case. And we have to determine if we have that or not. All right, but you can still help. It doesn't mean that we're not going to support them. We're not like, see ya, too bad, call me when you're feeling better. Cell salts are an amazing thing to use to help when you really can't see a remedy. Cell salts are minerals that we do use in potency, but these are only potentized to the X potency, which is a 1:9 ratio. And so they're a little bit more material, and they're almost like a mineral, like homeopathy vitamins or something. They really do support like the physical body and the system when it's feeling, when it's run down, when it's out of balance. This is my go-to in my house, to be quite honest. I've got teenagers. They're not really interested in doing a homeopathic intake with me for a remedy. And I just say, take some bioplasma or, Calimere and Natmere and Calc Phos for a couple days. And that almost always supports them just enough to get them through. So, I'm not going to go into what all the different cell salts are for, but there's a lot of good information on them, and it's a really good investment. You can do a lot at home with just the cell salts. All right, how's everybody doing? Good? Am I talking too fast? Okay.
Great.
I've been accused of that since I was a kid, so just tell me to slow down. All right. Because it's always good to show, not just tell, let's just see an example of a vague case. So let's say we've got Don. Don's your uncle, your neighbor, your cousin, somebody, and he complains that he's sneezing, has a runny nose, a sore throat, and a slight cough. He complains of soreness in the throat, but it's only slightly sore. It's not better or worse from swallowing food or liquids. Doesn't matter what the temperature is. He has a slight headache. It's dull, has some pressure, but it's very mild, and he feels it all over the head. He has periodic coughing, but is mostly dry. Coughs a little bit here and there. Runny nose is clear, sometimes runny, sometimes stringy, no consistency. He's tired, wants to lay down, would rather not walk around. I don't know about you, but I have no idea what I would give in this case. There's nothing. There's just really nothing to hang your hat on. We can't really get at a similar. There's no way to individualize it. Now, if we consider Rachel has a stiff neck and back. It hurts too much to sit up and move around. She's way better lying down. Her head feels really heavy, like there's a big heavy weight pressing down on the top, and it's better with a cold, wet washcloth. and it's sensitive to light. So when she's in the sunlight or the lights from up above, it makes her head worse. Her runny nose has green mucus. She feels lethargic, exhausted, but not just tired. She really wants to sleep. She's very sleepy. She's thirsty for cold water, can take down a whole glass at a time. And with the fever, she's super hot to the touch, but she also wants to be covered up, but sometimes will shiver. She wants company, doesn't want to be alone. Her eyes are congested, red, lacrimation, leaking, glossy, and color, lots of color on her face. So you can see the difference here. There's a lot of descriptions about how Rachel's feeling. We've got sensations in the headache. We've got things that are better or worse. We've got descriptions of how much she wants to drink and what the fever is like. These are symptoms that we could go find under the descriptions of a remedy or in the repertory if you're using the repertory. So that's the difference between a vague case and a clear case. The thing about a vague case is sometimes you don't have to wait too long. Just waiting an extra 24 hours, sometimes those symptoms will start to clarify, and then you'll have something to go on. All right, so let's talk a little bit about receiving the case, which is basically taking the case, but I liked my receive, analyze, decide, evaluate flow of the words, so that's what I said. All right. Again, with Hahnemann, he told us the individualizing, what's that word, individualized examination of a disease case demands nothing of the medical art practitioner except freedom from bias and healthy senses, attention while observing, and fidelity in recording the image of the disease. Translation, don't be biased, don't put yourself in the case, and be truthful, be faithful to what the person is telling you. Don't use a different word than what they said. It's a trap if you fall into these things. One, you think you know the person, so therefore you think you know how they get sick. We live with people who we observe in their illness, and it may feel sometimes like, I know what happens when they get sick, or I saw them this morning. I know how they were feeling. That would be being biased, and that would also not be faithful to what is actually happening in the case. Just because you've seen them get sick before does not mean that that's how they're sick now. I didn't include this aphorism in here, but Hahnemann also speaks to this. He's speaking about epidemics, but he basically says, you've got to pretend like every illness is like you've never seen it before. Doesn't matter if you've seen it 100 times or you think you've seen it 100 times. Every time you look at this new disease, it's got to be like you've never seen it before. So, and even with people you live with, that is the kind of approach we have to have when we're learning about what's going on for them. Because if we want to find this similar, it's got to be similar to what they're actually feeling. It can't be similar to what we think they're feeling or what they felt like last week or what I felt like when I got sick. Oh, I had the same thing and it was like this. This remedy worked for me, so I'm going to give it to you, right? We've got to find out what's actually happening for them. Also, be careful about assuming that kids are too young to tell you how they feel or to tell you what their symptoms are. We have heard from kids as young as 3. They can maybe point to something, where's it hurt in your tummy? Is it above the belly button, below the belly button? Where on the head does it hurt? They're real good with locations that they can point. I have definitely heard from a parent and then only to turn and ask the kid and have the kid say something the parent said, I didn't know you felt like that. You didn't tell me that this morning. That happens all the time. So we need to hear from the actual person who needs the remedy. We definitely need the observations of the caregivers, but we've got to hear from the person who wants the remedy, and that includes your own kid. The other trap is just giving somebody the remedy that worked last time. It's real easy. It's real simple. Hey, probably a lot of times it works, but it is a trap that we can fall into where we just give the last thing that worked. And it's understandable why we do these things, because this is how people deal with over-the-counter medicines when they're not doing homeopathy. If you always use Robitussin and Robitussin works for you, then you're just always going to go to the Robitussin. There's really no other option. It's just a brand game. But for us, it's not a brand game. It's really about finding the exact, or not exact, I'm not going to say exact. It's really about finding the specific similar that that person needs at that time. And it definitely might be different than what they needed the last time. So how do we do this? How do we go about getting this information? Open-ended questions are the best way. How do you feel? What is your worst symptom? Tell me about your headache. These seem super basic, but it's actually harder than you would think. And if you're not sure, just try having a conversation with the people in your house where you only ask open-ended questions. And very quickly, we start to learn how often we ask leading questions or give people an answer in a question. Was your day stressful? You've just given them an answer. You know, do you want, you know, this or this? We give choices all the time. We really want the person to come up with their own descriptions and their own expressions of what's going on for them. And especially important is to ask follow-up questions. If somebody says, oh, I've got a pounding headache, we don't just say, next. We say, oh, tell me more about your pounding headache. Where is your headache pounding? When do you feel it pounding? Is there anything that makes your pounding headache better? Is there anything that makes your pounding headache worse? Think about your what, when, how type questions. Don't argue with people, especially if you've observed them and they say, I feel like this, or it happened like this. Just take what they say. We want to, again, as Hahnemann said, like take the case with fidelity, with faithfulness to what the patient actually is expressing. And take notes. It may seem like if you're living with somebody or you know somebody that you'll just remember, or you've been watching them all day, but if they're giving you exact words and descriptions, just write it down. Have a little notebook. You don't have to write down every word that they say, but you want all of those little details and you want to be able to refer back to it. Some people may be very familiar with this little framework called CLAMS. Mary Aspinwall is a homeopath on Facebook. She's got an incredible group with tens of thousands of people, and that group is run like a well-oiled machine. I went on there to see what might be some questions that people have that I could kind of address, you know, just thinking about home prescribers, and I literally couldn't find any. Everybody was presenting their cases in this CLAMS format. And it was super straightforward and simple. It was amazing. Anyway, this is a really sweet, straightforward way to think about getting symptoms. So one is the condition. Now, this doesn't mean the diagnosis. Let's say you're treating a kid that has a diagnosis for, you've taken them to the doctor, says they have an ear infection. Fine, there's an ear infection. But how would you describe that if you didn't know it was an ear infection? You know, maybe you know, pain and tugging of the right ear, or you know, redness, heat, redness, swelling, and pain in the right ear, you know, boring their finger in. How would you describe it if you didn't have the clinical language? That's what we mean by condition in homeopathy. The location, not just the part, not just the head, but like the top of the head, the back of the head, the sides of the head, the neck extending over the top, the right side, the left side, you know, the right lumbar, the left lumbar. You get real specific with locations. Is things going down the back of the throat or stuff coming out the front? Is the pain in the chest like at the sternum, or does it feel deeper in the lungs? Those kinds of locations matter to us. Etiology, fancy word for cause. You know, did this cough come on after a day of skiing outside in the cold or sledding in the cold? Did it come after working outside in the rain? Did it come after somebody was scared, had like a big fright or a big shock, and then they started coming down with symptoms? Not every acute or not every not every acute has a cause that we can point our fingers to and determine. So sometimes we just don't know, and that's okay, because the cause isn't the symptom that's going to lead us to the remedy, but we have remedies that we know that have good clinical evidence for being effective um, with certain causes. So that can be helpful in differentiating. Modalities, which is our word for saying what makes something better or worse, what modifies the symptom, could be temperature, could be position of the body, could be eating or drinking. It's not medications that you take or herbs that you take or things like that. So if somebody says, well, my headache is better from Advil, that's not a modality. But if the headache is better from, an ice pack on the head, that is a modality. And then finally, the sensations. And actually, sorry, I should be on this one. The sensations are all of our adjectives and adverbs that basically get at those things that we can describe with our five senses: what something looks like, what it feels like, what it smells like, what it tastes like, and what it sounds like. So if it feels burning, if it's dry, loose, rattling, yellow, green, pink, etc. All right, back to some of our traps. I tried to frame these in the positive. So the trap is when you focus on the diagnosis, not the symptoms. So the thing we want to do is focus on the symptoms, not the diagnosis. This is important. Diagnoses absolutely have their place, but if we're trying to develop good homeopathy habits, we want to focus on the symptoms. Because if we go to the diagnosis and we say, oh, okay, it's an ear infection, then we're real likely to just Google best homeopathic remedy for ear infection or top 10 homeopathic remedies for tonsillitis or something like that. And now we've gotten very far away from our pillars of similars and individualize the totality, right? Or provings, because when we are learning about what remedies can do through a proving, those provers are producing symptoms. They're not producing diagnoses. The only reason we can say these remedies are well indicated for a certain diagnosis is because the symptoms that they are good for also look like those things that have been decided are the diagnosable criteria for a certain condition. So lead with the symptoms, not with the diagnosis. Again, the adjectives and adverbs really important, much more important than the nouns. If it's a cough, but if it's a barking cough, I like that. I like barking cough. If it's a, it's a headache, not so helpful, vague, right? If it's a burning headache, if it's a headache that feels like your head's going to explode, that's good. Think about your middle school, maybe writing teacher, all that show don't tell stuff. Really want to know what those characteristic symptoms are, again, so we can individualize and get to the similar. Consider your common symptoms very carefully. I already read that aphorism where Hahnemann said, it's really not going to get you anywhere. But look, I will tell you that there's always a common symptom or two that sneak in. So just use them, use them sparingly in what you're considering. For the most part, you want your characteristic symptoms, your clear symptoms, because individualization of those symptoms is what is going to lead us to the similars. So once we have received the case, now we need to analyze the case. What do we have on our hands? What are we going to do about this? When we kind of have our group of symptoms, we call that the totality. And that creates the individualized totality that we're going to then match to the remedy. So here's a little case example. So we've got Stacy with a dry throat, started last evening. She has become anxious with one-sided ear pain on the right. That ear on the right side feels like it needs to be popped. It hurts when swallowing. Her tonsils are swollen. The right side is worse. The sides and the back of the throat are white on each side. Splintering throat pain extends to the ear when swallowing, and the throat pain is better with warm drinks. So if we were to put that into our kind of CLAMS framework, we would have the condition, I might say a right-sided ear pain and sore throat. The tonsils, right side, the ear, the right side. So seems to be a pattern of things happening on the right side. We don't know what caused this. She started to get sick. Worse swallowing, throat and ear pain is worse swallowing, but better for warm drinks. The throat is dry, ear feels like it needs to pop, white on the sides, and swollen throat pain. So just a real simple way of sorting it out. Might seem a little bit repetitive, but it's kind of, it just gives you the symptoms in a way that's organized that you can then kind of map onto remedies as you're reading them. So the traps in analyzing a case are when we don't focus on only those symptoms that are a change from the person's normal state. So what we do want to do is focus on the change from the normal to the acute. Everything that that person experiences on their day-to-day does not become part of our acute case. So for example, if somebody always drinks ice water, the fact that they still want ice water when they're sick, it's not really valuable because it's not a change. But if somebody almost always wants like room temperature tap water, and then when they're sick, all they want is ice water or popsicles, that becomes a really valuable symptom to us. Same thing with somebody's mental emotional state. If you've got a kid who's whiny and weepy all the time, the fact that they're whiny and weepy during the cold does not instantly make them need pulsatilla. They're whiny and weepy all the time. Not to mention the fact that it's pretty typical for kids, again, kind of common symptoms, to want some comfort when they're sick. It might be much more of a valuable thing that they don't want comfort, right? If a kid normally does want some consolation, but is squirming away from you and don't touch me when they're sick, then that becomes something that we're really going to take notice of. Personality is not pathology. We're not giving the remedy in the acute for the person's personality. You can give Nux vomica to somebody who is not irritable and driven. You can give pulsatilla to somebody who is not weepy and needs consolation. You can give bryonia to somebody who is not actively being super grumpy. As long as their mental state has not changed, if they're just being who they are, just a little bit more tired, but their physical symptoms fall, under those remedies as ones to consider, you can absolutely give it. You don't have to have the whole personality thing. I hear a lot of folks discount remedies right away because they say, oh, yeah, I can't give lycopodium because they're not beating up on anybody in the house. Of course you can. It's just not what's happening for them right now. The cause matters, but it matters if it's a true cause. So if, for example, there was a definite shock or some kind of fright or something like that, and then the symptoms followed that, then you definitely want to consider that in the case. If somebody was exposed to a bunch of cold weather, wet weather, damp weather, something like that, and then their symptoms started, then that exposure and the worst from the cold and wet could definitely be a piece of it. But we don't want to create a cause where it's not there. And if you're not sure, leave it out. Because again, we have the symptoms. Mostly by symptoms, you're going to get there anyway. But if there is something that did occur that set this off, then it is something that you want to consider. So to that end, when you're asking the person what's going on for them, We always ask, well, what was going on when this happened? You know, what was there anything that happened that day or the day before? Anything unusual, something like that, just in case. All right. So finally, we need to decide on the remedy. So once we've kind of sorted all our symptoms and we've got our list, now we need to compare these symptoms to the remedies that could be a good match. So when we're choosing a remedy, we always want to compare the case to the remedy and not the remedy to the case. AHE students will be nodding their heads because we speak about this quite a bit. There's pretty straightforward reason why. If you have ever read any kind of materia medica or description of a remedy, you'll notice there's a lot of symptoms. Some of these remedies have thousands and thousands of symptoms. There's no way that anybody could have all of those symptoms. So to start reading through the remedy, you're going to mostly say no, 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 no. We're going to discount the remedy before we even get started. But if you just start with your totality and you say, okay, this person has yellow or green discharge. Does the remedy have yellow or green discharge? It does. Check. I'm going to keep considering this. This person has a headache, like one of the sample cases I had, like right on the vertex, like a heavy weight pressing on it. Does the remedy have that? It's got that. Good. I'm going to keep reading. You can discount usually 95% of what's in the materia medica. That helps to keep it focused. It also keeps you from being distracted by all the parts of the remedy that are maybe really chronic or feel really like, oh my God, my person doesn't have gangrene. How can I give this remedy that there's gangrene in this remedy? Well, most remedies have like a spectrum, you know, they've got an acute presentation, they've got, you know, symptoms that are more mild as things get going, and then they've got the progression of the state or the symptom complex. So just because something seems like it's a super intense remedy, and this person is definitely not that bad off, doesn't mean that it can't be a good match. Use reliable sources. That's probably one of the best things you can do for choosing your remedy. And I really recommend going old school and getting some books through thrift books. If you don't want to go to Amazon, or through Amazon, you can pick up some really good, reliable books that will become like your best friends. I really love Miranda Castro's. This is the Complete Homeopathy Handbook. This was actually my first book, and I think it's fantastic. It's a really good, approachable materia medica. She even walks you through how to repertorize if you want to start getting into rubrics. And I think it's just super straightforward, and Miranda's a great practitioner with a lot of experience, so it's very reliable. Another one might be this one by Stephen Cummings and Dana Ullman. This is the Everybody's Guide to Homeopathic Medicines. I was reading through this a little bit. I kind of liked how it would differentiate the remedies. It would compare this one to that one. That's a good one. And then if you're somebody who maybe feels like you deal with a lot of injuries in your household, kids in sports, things like that, this Asa Hershoff Homeopathy for Musculoskeletal Healing, it has great diagrams and really nice just kind of flow charts and, you know, cool kind of graphics that are super easy to look at. You don't need all the materia medica that you can access online. If you're at home, one or two of these books will really probably be enough for you. You can slowly add to them as you get more familiar. I really don't recommend researching remedies online. Anybody can write anything online. You want reliable sources. These books are written by practitioners who have a lot of experience. and you can make notes in them. You can go back to them. I really recommend sticking to the books. And, you know, if you want to look up something here or there online, that's fine. But this will also aid you in that first thing I said, which is, you know, focus on the symptoms, not the diagnosis, because these books will maybe mention a diagnosis, but they're definitely going to be homeopathy system led. A lot of the stuff you find online is just gonna, it's just gonna tell you like the top 10 remedies for this condition or that condition or something like that. And that just doesn't, it doesn't reinforce the mindset that we want to be developing in homeopathy. When you're looking at remedies, a lot of times there's a couple remedies that look really good. It's kind of hard to choose between them. So when we're trying to kind of see like which would be a better choice, there's a few things that I think about. So one is definitely the characteristic symptoms. If there is your common symptoms, you know, your lack of appetite, your tiredness, all that stuff, that's a given. But characteristic symptoms like green nasal discharge, for example, or, you know, only wants ice water, won't have anything else, especially the ones that are a very strong opposite from the person's chronic state. Those will be the ones that you're going to want to kind of elevate above other symptoms. Mental symptoms that really are a shift from the person's normal state are another one that you can definitely put towards the front. So again, if somebody's normally not irritable and not anxious or doesn't tend to be the cuddly one, and then they are like that in the acute, then you can take that as an indication. I remember my oldest, I actually really liked it when they were sick because they were not the cuddly kid. And so when they were sick, like we actually got to snuggle on the couch together. So pulsatilla did actually tend to work very well for them, but not typically like that as a just healthy person out in the world. So pay attention to those characteristic symptoms, and also the ones that are kind of the deepest things, like what are the symptoms that could become problematic? You know, if somebody's got a respiratory thing going on and they also have body aches and pains and a headache, you want to absolutely make sure that the cough or whatever respiratory thing they have going on is covered by the remedy, because that's the thing we don't want to get worse, right? We don't want it to go into bronchitis. We don't want it to go into pneumonia. You know, especially if somebody has an underlying condition like asthma or something like that. Well, it would be very rare for somebody to end up in a very bad state because of body aches and pains from the flu, but respiratory stuff can get rough. Same thing if people have diarrhea or they're vomiting and you're dealing with kids or even babies. You know, the concern is that they could dehydrate. So we want to make sure that whatever the organ system is, or the, you know, the symptom that is connected to the part of the body that is kind of the deepest, we would want to make sure that the remedy covers that well. At least that's something that I do. And finally, another thing that can help is considering the stage of the illness. So for example, we've got remedies that are much better suited to the beginning when it's just sneezing, kind of watery, runny nose, run down. I mean, again, that might be a stage where you can only give cell salts because you can't see very much. But something like Napmure, for example, is often good at the first stage of a cold where there is that sneezing and egg white runny discharge and things like that. Pulsatilla is often good for the second stage of a cold or the riper cold when everything is yellow and goopy and it's had some time to kind of ripen. And then we can do something like sulfur at the end, which can kind of clean things up when people are mostly better, but they've just got the goop hanging around and it's just not, you know, it's just not wrapping up. So if that's something you're aware of, that's something you can use when you're trying to figure out, you know, what type of remedy would be appropriate based on the symptoms. Okay, So then we get to, you've picked your remedy, you found the one that you think is the best similar to start with. Now you have to choose the potency and then how you're going to give it. Now, this usually tends to be something that, well, sometimes it can send people into a little bit of a tailspin because they're not sure what potency to give or how often they should give it. We can keep it super simple. For most cases at home, a 30C is a safe and a reasonable place to start. Some people only keep 200s at home. If you've got, the person has a pretty high vitality, or you're not dealing with a very elderly person, or somebody with a predisposition that's concerning, or like a progressive chronic disease where their vitality is low, then a 200C is probably fine. And but most people have a 30C. And so even if you've got somebody who's got a high vitality, you can still give them a 30C. And I'm kind of doing vitality speak, which is actually something that we talk a lot about at school, but isn't something that's often part of the conversation outside as much. Well, I have to think about that. At any rate, I don't want to complicate things. 30C is a safe and reasonable place to start. So we don't have to think too hard about that. The biggest place where I actually see people getting hung up is how many doses to give. And this is the place when people come to HHN is the reason why they came to us, because they'll say, well, I gave a dose of the remedy and I don't think it helped, but they only gave it once, or maybe they gave it twice, but then they didn't know what they were seeing and they didn't know what to do, so they stopped. My personal rule of thumb is usually to give at least 3 or 4 doses before making an evaluation about whether it's a remedy to stick with or not. Unless the person has a very strong improvement or a strong aggravation. If you give after the first or second dose, it's like big turnaround. Great. Now we just have to give a dose when things start kind of regressing or going downhill, if they do. But sometimes maybe that's enough. Again, remember the kid on the swings that you're giving them a push. If they're still pumping, we don't need to push them. Likewise, if the person has an aggravation, if the symptoms get a little bit worse after a dose, then we just want to wait. Oftentimes, things will get better after that aggravation dies down. And then you can watch how long they stay better and only redose if it's needed. But for the kind of not really sure results or no results, I usually give 3 or 4 doses over several hours, and we're talking about for like an acute illness. And if there's really no change, then I might consider giving a different remedy. Or if the symptoms change, we have to think about a different remedy. But I don't really make that determination until after I've given at least 3 or 4. The other thing is to repeat the remedy in water. It's a really simple way to do repetitions. You can put a couple pellets in a little half cup of water. And the nice thing is you can stir it or give it a little shake, and it kind of changes the potency just a hair, like just enough to make it a little bit different. And that often just kind of keeps things moving along nicely. The frequency of how often you're going to give the remedy depends on the intensity of the case and the duration of the response. So if the case is very intense, and then you might need to give the remedy more frequently. If the remedy, if the improvement only lasts 30 minutes, a half hour, then you give the remedy when it's needed again, just like we give the push when the pumping stops. Now, if the remedy isn't lasting very long and you have a 30C, but it is improving, then you could safely use a 200C. You could go up because that would get you a little bit more time. But the general rule of thumb is that while there's improvement, you wait. When the improvement starts to die down or the symptoms return, you give another dose. That could be, again, 30 to 60 minutes, could be hours, could be a whole day. So then we have to evaluate what happens. We've chosen the remedy, we've given the dose or the doses, and now we need to figure out what happens so we know what to do next. So part of that is a little bit of what we already just talked about with, watching the improvement, and, if there is improvement, just give the remedy again when the improvement dies down. But there's some other things to consider. So a positive response often starts with things like the mood shifting, the energy improving, appetite improving, quality of sleep improving, or if somebody falls asleep right after they get a remedy, sometimes that is like often the best response, because there's so much healing that happens and restoration that happens when somebody sleeps. So those are things that we tend to see change first. I've taught this before. I've said, like, if you've given bryonia to somebody and part of their picture was that they were grumpy and wanted to be left alone, sometimes improvement looks like the person who had their back to the room turns around. They leave the room. They come out of the room where they were sequestered away, not wanting to deal with anybody. And they come into the kitchen to get a drink of water, and they actually start conversing. You might see something like that. That's some of the first things you'll see. Or, haven't been interested in eating all day, wants to try a couple bites to eat. That's a sign that things are starting to shift. We also look for a decrease in intensity and frequency. So it doesn't mean that the symptoms, improvement doesn't always look like the symptoms just disappearing. Think about it like a volume, like a volume lever. Like we're just turning the volume down on things. Sometimes the volume gets turned down a lot, but it's still there. But sometimes we just turn it down a couple of clicks. But if we start to see things get a little bit better, not coughing every 10 minutes, now they're coughing every half hour. Or the intensity of the cough, went from somebody coughing until they were gagging to, now just kind of, coughing hard, but they're not to the point of gagging, or the expectoration becomes easier to get up, things like that. I like to really think about improvement in terms of they don't get worse. You're preventing sequelae, which means you're preventing additional symptoms or other things that kind of come about as a result of this illness. And you're supporting the body in healing. One of the key questions we ask when we're supervising students at the Homeopathy Help Now network is the remedy moving the illness towards resolution? Every student, when we evaluate a case, this is one of the questions that they have to answer. And if the answer is yes, then we stay with the remedy and we keep going. And that's really important, because one of the biggest traps is the search for the unicorn remedy. I have had the experience, as have maybe many of you, of seeing a remedy work so completely, so quickly, it seems miraculous. I have the story on my website. I've told the story before. My son got a remedy within minutes of birth, and he got aconite, and it was like he stopped screaming and like came to earth. And if that was my only experience of homeopathy, I would think that needed to be the response every time I give a remedy. But that isn't the response every time we give a remedy. And furthermore, it can't be the response every time we give a remedy. There's got to be a very specific set of circumstances in place for that to happen. It's got to be a specific type of situation that was an acute, intense situation that had a very specific presentation that happened to match the remedy that I had in the house in the right potency, or in the potency that was best suited to him. He was a baby with like high vitality. There were so many things that came together so that was that kind of miraculous, amazing response that happened in that moment. We have over 5,000 remedies in the homeopathic pharmacopoeia. I'm not saying that in many acutes, there isn't a unicorn remedy that could match that person's symptoms and state at that time. But do they have it in their cabinet? Do we even know the remedy? I mean, there's a lot of things that are kind of working against us in if we're always looking for that magic remedy and that miraculous response. So the idea of supporting a case with a remedy that is moving the person towards resolution, that is helping to decrease the intensity and frequency, that is preventing the person from getting worse, that is supporting their body and healing, that's all a big win, you know? And it helps us from going crazy thinking that we made the wrong choice all the time. The cases that come through where people have given a remedy and they kind of gave up are because the expectation was after that first dose of the remedy that the person should have been like 75 to 85% better. And oftentimes the person gave a good remedy. Many times we just continue the remedy that they gave. We evaluate the case. We say, you know what? You gave phosphorus. Phosphorus was a good remedy. It's just you didn't give it enough. Or we have some, one of our students is Dasha here. She was here. She calls them our potency ninja moves. When you work on an acute helpline for a long time, you learn some different things you can do with dilution and you know, giving a remedy so that you can extend the efficacy of a potency for a long time. And by applying some of those techniques, we often will get people to the end of their illness with a remedy that was somebody was ready to give up on because it didn't miraculously cure it after one dose. So beware the unicorn remedy. I think it is one of the biggest things that trips us up. And you know, it's always good to be looking. It's always good to know that it's out there, but it's a rare one. But when do we change remedies? There are definitely times where we change remedies. If there's improvement, but no new symptoms, you're going to stay with the same remedy. But if the symptoms change, you've got to change the remedy. Acutes can be kind of fast moving. I mentioned earlier, there's stages to illness. So once somebody's kind of out of the fever stage, the body aches and pains, kind of the clear runny nose, oftentimes their symptoms shift so that now they need a different remedy than what they started with. Sometimes the same remedy will move people through, but I often use the example of my son. One of the things that made me fall in love with homeopathy was me learning the trio of remedies that would help his croup. So we'd go from spongia to hepar to antimonium tart. And it was amazing. And it would move him through in a weekend. And most of the time he actually did need those three remedies. I wasn't in homeopathy school at the time, so I definitely was like, well, this worked last time. And it did. But I definitely learned that his symptoms changed, and so I had to give a different remedy. And it was an incredible learning at home of how homeopathy could meet the moment and just address the symptoms that were at hand. So don't be afraid to change the remedy. I think that's another thing that we hear a lot in people who come to HHN who have given a good prescription at home, but then the case changed. And so they think, I must not have given the right remedy because the case changed. And it's like, nope, that's just what happens with an acute. Even with injuries, you know, we might give arnica in the beginning, and then often we'll need to give rust tox, or we'll need to give bryonia, or we'll need to give some other remedy that will kind of help with the healing moving forward. So very rarely does an acute need just one remedy from start to finish. That's actually true of chronic cases too, but we're not talking about chronic cases. Super important, one remedy at a time. It is very hard to do the evaluate part of this process if you've given three remedies, because we don't know what we're evaluating. Was it, which remedy worked? You know, which remedy is the person responding to? we've definitely had cases that have come through the helpline where the individual was given 2 or 3 remedies in a rotation and not really very much happened. The illness was not improving at all. And when we evaluated the case, one of those remedies was a really good match, the other 2 not so much. So we went down to 1 remedy and the case started to move and the person started to get better. But because they were given in rotation with more than one, the person wasn't actually able to respond to the remedy that was a good match because other remedies kept being given in succession. A metaphor I like to use for that is like, try learning 3 songs at the same time. How could, it would be hard. We're sending the body a message. Hey, do this. And it can't do that if it's getting 3 messages or 4 messages at once. All right. One of the things that happens that can be a little bit confusing is that as the person starts to get better and the illness recedes, the picture becomes less clear.
Kelly,
Yeah.
I'm sorry to ask, but I had a quick question about what you just said prior to the starting about the picture becomes less clear.
Oh, sure. Yeah.
You said the person called and had taken multiple remedies in a row, and then you, the prescriber, whoever it was, felt that one of them was good, so then they gave that one. How you didn't have to do anything in between? I mean, like they've just taken these bunch of remedies, maybe their body's confused. How did it come back to being not confused?
Yeah, no, because as soon as it was just, we were giving the 1 remedy with the 1 message, it was like the vital force, like oriented towards the remedy was like, okay, it just responded to that 1 signal from the remedy. We didn't have
So
to
it's fixable
Oh
if
yeah.
someone does that. Okay.
Yeah, it's trickier, in chronic cases, if there's, if these things get repeated over time, like in a chronic situation, that's a much hairier beast to deal with. But in acutes, usually as soon as you kind of get on track with, a good match, you'll get a response.
Thank you.
Yeah, so as illness recedes, the picture becomes less clear. So that can be a little bit confusing. It's like, oh, do they still need this remedy? Because they don't actually have the yellow snot actually anymore. They actually don't have the body aches anymore. They actually don't have the fever anymore. When that happens, there's a couple different things you can do. If they're still responding to the remedy, you just give it less often. It's like, when do things seem to kind of set back a little bit? But the other thing is, what I'll often do at that point is shift to cell salts. If the person is basically 75% better and the majority of their symptoms have cleared, and now you're in vague case land again, it's like we've almost come full circle, right? It's like you have to wait for the clear symptoms to treat. And then when it goes vague again, you can stop. And often, things will just kind of progress from there. Our goal is to assist the body in resolving things. We don't need to push it all the way over the finish line usually. But cell salts can be a really nice thing to kind of pick up at that point and just kind of keep supporting until the person's feeling, 95, 100%. And that's what I just said. Okay. So actually that's the last of my content slides. I'm happy to answer any questions if anybody has them. I just kind of raced right through from beginning to end. Normally I do like to stop and get questions in between, but
I did have another question.
Sure.
You told the story of Rachel and then Stacy, your examples, and I wondered, what were their remedies?
Oh, one of them was nitric acid. That was the one that had the swallowing that went to the ear.
The splinter-like pain to the ear, that was nitric acid. That was Stacy.
Yes.
Okay, and Rachel was the pressure on the head.
Yeah, and that one, I don't think I actually took note of what the remedy was.
Okay,
I actually just grabbed the case.
Thank you.
I was looking more for the symptoms. Yeah. Any other questions?
Yes, I have a question.
Yep.
How do you know if it's the right remedy in a very chronic condition? So say it's been quite a few years. How do you know if they're not seeing a reaction initially? How long would you carry on with the remedy?
For a chronic condition?
Yeah.
Yeah, I don't actually think I can answer that because it's every chronic case is quite different. And all my points here, while some of them can be applied to chronic cases, this is really targeted at treating acutes at home. Chronics are a whole other ball of wax.
Okay, thank you.
Yeah, sorry.
Kelly, do you have a favorite book about cell salts that you use?
I didn't grab it. I do have one that I reference, and I'm sorry I don't have it like right at my fingertips to grab.
Well, if
Yeah.
you remember it, send me a message or something.
Yeah, I will. It's probably on my bookshelf somewhere, but it would take me a few minutes to find it. Anything else? All right, well, remember, we are here for a benefit for the Home Foundation, of which HHN is an integral part. And you've heard me tell several stories about how we've supported home prescribers through HHN. And they're really some of my, like I said in the beginning, like there's some of my favorite cases to do because I really feel like we do this kind of dual service of both like helping the person, but then we also do a little bit of education. And I think that home prescriber gets to see what they started kind of go to fruition, and just with, the approach of those of us who have been studying and working with it for a while. So any donations that you make, support all of these really great efforts and help further homeopathy research, education, clinical availability for everybody. It's it's pretty awesome.
I just want to jump in and say thank you, Kelly. It's been really fun. I have to admit, I'm listening in the background while I'm cooking because it's been a little bit of a long teaching day, but I learned things and I really enjoyed it. And I'm so grateful for all of you who turned up to support Home Foundation, to learn from Kelly, and yeah, just to be here, especially some of you students who I know have been on the scene all day long. It's just amazing. And I think the one thing that I want to just add is how amazing Kelly has been, is as a part of the AHE and home team. When we met, it was one of those like love at first sight things. We met, as Kelly mentioned earlier, on her podcast. We're like, what do you think about teaching? And next thing you know, Kelly becomes the most integral part of this organization. I actually don't remember AHE without Kelly at this point. And so, I don't know. It's just really, it's such a gift to listen to you and to I don't often get to sit in on your classes. So there's Al running by because he's working a grill, getting some dinner on the table. But yeah, it's just amazing. And I'm really grateful. And thank you for taking the time to do this part of our benefit, Kelly. We love you so much.
Oh, thanks.
Yeah.
It was fun to put together, and I appreciate everybody turning out. And yeah, I'm so grateful I have a home here, because homeopathy, like we gotta dig a little bit, we gotta look, we gotta find our place. And when you find it, it's something we park ourselves, so I'm really grateful to be here and learn alongside everybody else.
Mhm.
Yeah. Well, thanks everyone. Enjoy the rest of your night. Take care.
Thanks.
Thanks, everyone.
Bye.